that conversation to know what you, yes you, can be able to do to prevent that bite. We're joined by Dr. Henry Katamba from the Ministry of Health. He is the National Facilitator of the Global Fund. You're most welcome to Morning at NTV, Doctor.
Thank you. Thank you so much.
You're welcome. Now, let's start from that point whereby we did celebrate, last week in Aleptong district. How are the celebrations? How was it? How was the event pretty much? And what was the highlight of that?
The event actually achieved most of the objectives that we wanted. There was a very big turn-up from the local community, the local leadership. We also had a very big turn-up from the leadership from the center. Actually, it was officiated by the representative of the Deputy Speaker of Parliament. And we saw quite an amount of display of what the community has actually been able to appreciate in terms of the message and the tools that are out there. And it kind of resonated with what we are seeing in regard to the fight against malaria at the national level. So
there's change of mindset.
Exactly.
What about the uptake? Of course, we do know that the Ministry of Health has been at the forefront of preaching the importance of sleeping under treated mosquito nets. What's the uptake in the villages?
First of all, the communication around the prevention of malaria actually rests on some of the interventions that have actually been done by the Ministry of Health with support from development partners. Almost every household in Uganda, actually 90% of the households in Uganda, have a mosquito net. So the communication is actually focused towards use of those nets. And in regard to uptake, it is very high. We have seen actually an increase up to over 60% of the households, people at the household level, are using the nets. And that is a very big achievement. Yes.
And as we talk about, if you're going to give a net, we need the person to actually use the net to stay away from malaria. And as the entire world, as World Malaria Day was being marked, the international theme was Zero Malaria Starts With Me. Everyone. And as a country last year, we decided to take on a new strategy, which was mass action against malaria. But this year, we're now seeing that it's going to be implemented. What is this strategy all about, and how does it come down to Mala, to me, and to you, and to anyone watching?
Yes. Now, mass action around malaria, we've realized that we have to, now that the tool is out there, the tools are out there, the information that the people have about malaria is very good. Now we are focusing on action. What do you need to do? And the focus being put on the household actually means that we've recognized the household as the lowest unit, where action can actually result into a national and even a regional effect. Because Uganda has about the biggest number. It contributes a very big proportion of the number of cases in Africa and in the world. Meaning that when we actually reduce the burden in Uganda, it actually reduces almost in Africa and also in the world. Now, that action at the household level helps us to actually magnify the effect of the prevention tools, and it goes towards turning what we have in the mind into basic actions, like, yes, I have a net, let me use it, let me supervise the people in my household to use it, and that will actually have an effect on all your neighbors. In actually 10 households that are neighboring each other, you only need 2 disciplined households, and the rest will get protected.
Yeah, that's true. And the strategy of the Ministry of Health come 2020 is to reduce the malaria morbidity to 30 cases per 1,000. And it is achievable. But over and above us preaching, matters to do with the use of treated mosquito nets. what other thing can the public do to ensure that we bring these numbers down? Of course, the target again still being by 2020, we need to bring the instances to zero, down to zero, you know. So what we're above, you know, treated mosquito nets, what else can be done? Ask knowing that, you know, at times we say that, oh, my child, by the way, fell ill, took this child to the hospital. They sleep under a treated mosquito net, but they were diagnosed with malaria. So we actually don't look at matters to do with anything outside that. You could be watching a TV set, just hanging around your house, so to speak, and you know you get bit by this particular, you know, they say Anopheles.
Yes, female Anopheles.
Yes, female Anopheles. Yes. So what can we do to ensure that we bring that down?
Correct. Yeah, you're very right. We have other tools or other methods that are used to actually prevent malaria at the household level. One of them being indoor residual spraying. There are some people who are uncomfortable using the net, and yeah, they have the ability to spray the wall, because when a mosquito comes into the household, it first rests on the wall and waits for people to go to sleep. Correct. And it will come and bite. And also modeling of the environment outside, making sure that the breeding areas are all drained, and you also cut your grass outside, and that community effect, reducing the areas where the mosquitoes can actually multiply, will certainly reduce the density of the mosquitoes. And also, there are other practices over and above those traditional ones, like making sure that you close your windows and doors by 6 in the evening. That will reduce the density, because they also come in. They go out in the morning as we go out, and they come in the evening because they've learned.
We live as well.
Yes, the habits of the human being. And when you interrupt any of the processes that they use, then you also reduce the malaria incidence in your household. But also, we also have become alert. Any fever that you get, please don't ignore it. Rule out malaria. And this time round, the test kits are very available. You do a rapid diagnostic test, and you find whether you have malaria or not before you take your medication. Ideally, it is supposed to be within the first 24 hours of noticing a fever. All right. Yes.
But as we talk about the indoor residue spraying as a country, it's known as the most effective way of dealing with the mosquitoes. But one thing is that as the Ministry of Health, less than 20 districts receive this spraying. And one would wonder, we even have places within Kampala, and because of the environment that is around there, saying, one would question, why isn't the spraying going on over there?
Yes. The indoor residual spraying actually is very effective, but it's also very expensive. For every house sprayed, you could actually cover about 10 households with nets.
So I'd rather go
that's the simplest. That's the simplest I can say. Now, meaning that the funding that we can attract actually focuses on those districts where there is a very high burden. So if I got funding to spray probably 1,000 households, I would not select Kampala. Kampala, the prevalence of malaria, you have to count 100 people before you get one person who has malaria. So I would take it to, for example, West Nile, where in every 2 people, 1 person has malaria.
So we focus on that end. So for those, because it has been raised, wondering why has the government decided not to also spray on our end? We need it as well. And a number of times people say these things. But you also, you mentioned something about breeding. The breeding areas that sometimes due to farming, because some of the sectors within our country, in one way or another, contribute to the malaria within the country. So talking about, because mass action against malaria, it could be community, but also as farmers and other sectors that could be doing something wrong. Now,
I wouldn't want to crucify the farmers because they are doing something very critical. But we can work in partnership. Actually, to be frank, most of the malaria that is mainly in the urban areas, it is about the way we dispose of our refuse. You find areas, for example, places that have garages, and you find tires. All those areas, those are breeding sites, please, before you go to the farmer. All right? And also in the upcountry areas, how are we handling our drainage system? Normally it's a community action done, for example, once a week, or sometimes it is done when a big person is coming. But those are breeding sites, meaning that if we actually worked as a community in most of these public places, which are kind of communal, and we actually implemented the environmental management policies, we make sure that we implement them properly, you will get a drop.
Do we know of these policies?
Oh yes.
As the public, do we think that, because it goes back to the sectors, those that are supposed to be doing something about the environment, do they know that they need to be sensitizing the people? Because the Ministry of Health could be doing something, but what are the other sectors doing about this fight against malaria?
And you're raising a major weakness in the campaign. And as we focus at the household level, we also have to look at partnerships with the other institutions of local government, like the municipalities, KCCA. It has done a very smart job, by the way. Most of these road constructions have improved drainage, and that is one of the reasons why the malaria burden in Kampala is very, very low. But we also need to have partnerships with, like agriculture, you talked about it. Some of the herbicides that they are using have a cross effect on the insecticide that we are having. So it contributes to resistance, and that dialogue needs to actually take place. Yeah.
Right. When you talk about, fighting this endemic and bringing the numbers down to zero, we cannot, shy away from the conversation on drug resistance.
Correct.
What strides have you made at the Ministry of Health? Because much of these numbers, when you talk of morbidity, mortality, is because of drug resistance to this parasite. So what strides are being made by the ministry? Yeah,
in regard to resistance against the drug, there are some methods that are embedded in the actual treatment. You've heard of Coartem. Coartem is 2 drugs. You have artemisinin, you have lumefantrine, and that combination of 2 drugs actually reduces the development of resistance against the other. All right? So within the design of the treatment itself, there is a reduction, a prevention of resistance against the drug. And also, when you hear that we insist that please rule out malaria before you treat, that also is one of the major ways of fighting resistance. Taking the drug when you actually have the condition. When you don't have the condition and you take it, you increase chances of resistance.
Right.
And we also insist, by the way, even the medication has been made easy to take, meaning that the focus on you completing the dose, isn't it, is also another very important factor in preventing resistance.
Right.
Those are the things that we've put in place, but also communicating to the community, not to abuse. Some people like taking the injection because it is rapid acting,
quick,
and it's quick.
Right.
But it's a single dose, and it can very easily lead to resistance. And there we are focusing the fight on us, the health workers.
What happens to that patient who has already developed resistance, towards this particular, anti-malarial drugs? What happens to them? Because with resistance towards antibiotics, pretty much doctors will give you a stronger antibiotic. So what happens in the case of malaria?
Yeah, there are drugs that are there that are stronger, but more expensive. All right. We wouldn't want to actually get there. Lucky enough, Uganda, we've not registered resistance to that extent. We do efficacy studies every year. We take samples from sentinel sites, and we find out how the parasite is reacting to the available drugs on the market. And we've not yet registered the level of resistance that would worry us. But the management of a case that is resistant is very, very expensive, and it needs highly specialized care.
But when we talk about treatment, a number of people prefer to just, if I feel the fever, rush to the pharmacy, buy the drug, and self-medicate.
Yes.
But it's also very key to test before treatment.
Yes.
And where would you put, as a country, are we embracing the test before treatment? Are we still struggling to get people to actually just go to the hospital?
Yeah, the story that we have about self-medication is not complete, to tell you the truth. In our facilities, we see compliance to testing before treatment is way over 70%. The picture from the private sector, where people walk into drug shops, we know that that is happening, and it is very unfortunate, because the rapid diagnostic test is a very simple test. You can actually administer it in the household, at the household level. And it's one of the things that making it simple is one of the things that we have done to make sure that people actually rule out malaria before they treat. But we know that it is still taking place, especially at the drug shop level. And not all fevers are actually malaria, and especially now that the burden is decreasing. You may find some fevers that are caused by viral infection are more common than malaria in some places. For example, here in Kampala. So it is something that we are taking the fight back to the health workers, and there is a big focus on the drug shop, on the drug shops. Yes.
All right. Okay. And you do have feedback on social media. We did
Yes.
ask people what can be done to better achieve the goal of bringing down the numbers
Yes.
to zero. Of course, the morbidity and mortality rates. And we have Khan Joseph is saying, I would put a blame on the people themselves. Amidst government's efforts, the locals, especially in the rural setting, still do self-medication, like Rita said, and this puts them at risk of developing complicated malaria, which could be otherwise earlier treated. So that's a comment coming from Joseph. We also have Nobel Israel. He's saying fast sensitization. So sensitization for him should be the key to fighting this endemic. We also have Fred. He's saying empower the people, have sustainable income to sustain their families. How do you expect children with very low immune system to resist malaria? They can even be given 2 meals a day. Even minor flu can claim their lives. So he's saying that also the focus needs to be on financial empowerment, for these particular families, because he's saying that poverty is one of the key issues. If a family can hardly afford a decent meal for the children, the immunity is also affected, and so they become more susceptible to this particular practice or parasite, so to speak.
I hear you. And those are very valid observations. And in regard to affordability, the government has partnered with funders to make the drug, first of all, available at the facility level. So if you actually went to a health facility, it is highly likely that you'll find treatment for malaria when they find you positive. And in the market, there is a program where we subsidize the cost of the drug from the manufacturer level, and we allow we call them first line buyers, big pharmacies that import, for them to get it cheaply, but we insist that the drug should actually be less than 5,000 shillings. A drug that is a full dose is supposed to be 15,000, between 15 to 20,000.
But doctor, how true is that, especially when you're talking about drug stockouts of these anti-malarial drugs? Because my question is coming because we have feedback coming from Costa. He's saying that the initiative is not working because when you visit any health center or hospital, they say they have no medicine, and he's saying this is from his personal experience. We also have Mr. Robert Aneko. He's saying most government health centers do not have medications in them, and they send you to private clinics to purchase this. So how true is this?
We actually monitor the stock levels, and of late we have actually been having overstock. But some facilities have higher traffic of patients, than others. And you find that the ordering system is not linked to that, the consumption rate. And you can actually have a facility saying that they don't have stock, and yet another facility that is a stone's throw away actually has stock, largely because of the issue of consumption. And we're trying to actually work with the district people to make sure that we stock according to consumption. That is a working process. But we also cannot rule out scenarios where a health worker is not professional. The drug is there, and then they tell you, please, you go to my clinic and get it from there.
What are you doing to ensure that is sorted out? Because this is pretty much a crime, so to speak.
Yes, it is. We have actually made the the population alert. They actually send messages to the RDC, they send messages to contact people, health monitoring unit, and we've seen some of these arrests that take place. Those are the unfortunate ones. But to tell you the truth, around the country there is adequate stock for the antimalarials, and that is something that we need to know. And you actually talk back to the health worker.
But they have this power with them.
Oh yes,
that comes with it. And you know, a number of times, because I was in Boise last week speaking to some of the ladies on that end, and they say you go to a hospital like Chirudo and they tell you they don't have any antimalarials. They just give you Panadol. This lady already can't afford the treatment. Correct. She's going where she can actually be able to get it, and they tell her we don't have it. Yet they actually could have it at that point in time. Yes. And they say they opt for now natural remedies. So they're also trying to self-medicate on what nature is giving them, which sometimes is not very effective. Yes,
it's first of all, it's a process. We want to say that a scenario like that one is unfortunate. And why I'm saying it's a process, we are trying as much as possible to make it simple to report a case of that nature. And also, we are trying as much as possible to make the response between the actual contact and the people coming to check and verifying very small. All right? And that actually requires a partnership between the community and us as government. And that interface is actually going to improve a lot. But most of all, we are also working together with health workers to address some of the things that are underlying that kind of practice. Yes.
What timelines are we looking at? We know that the judicial system upped its game, so when are we likely to see the Ministry of Health, providing these platforms for people to report?
The platforms are there.
All right.
Yes, the platforms are there. And I know that the health monitoring unit has been sharing a number that where you can make your text messages and call in, and they actually respond.
What's the response time? That is what you're saying you have to improve on?
Yes, we have to improve on that. And those are some of the statistics that we need to also share with you. It's very, very important. But what I know is that there is no complaint that is left unattended to. None.
Just in case we have someone watching us today and maybe they're actually in a hospital and they've just been told we don't have drugs for malaria, go buy this clinic. What are the platforms that they can use to report these incidences?
Unfortunately, I did not come. There is a hotline by the health monitoring unit. I'm going to ask them to share. There is also that very same hotline you can call in. All right? And they normally collaborate with the pharmacy division of the Ministry of Health to get the status of actually the stock in those facilities. And they can actually make an action on it. Yes.
So as a country, you're moving from controlling to elimination.
Yes.
And there's the draft Malaria Elimination Act, which we'd like to talk about. Because if you're saying we're bringing every stakeholder on board, from religious leaders to people in the communities to the health workers, now our members of parliament, what does this act seek to achieve?
Oh yes, now it is very closely related to the mass action. The moment we make the fight against malaria individual, all right, and you say, I am not actually going to get malaria, my children or whoever is in my household is not going to get malaria, then we work together to make sure that we do those actions that actually prevent it. or catch it quickly and treat it. Now, the members of parliament have formed a forum where they say that we take ownership on the actual use of the tool, that is at household level, and the prevention. For example, our friends, the members of parliament from West Nile, they are going to actually unpack what it actually means to have a high prevalence of malaria like that. And they will go with the message down to the community level. And that is what we actually mean, that we now are talking about bringing malaria to zero. Any place that has malaria, it should be a responsibility of the local leadership, from parliament to their local councils, down to the village, down to the household. And that discussion should actually result into better actions that are actually take into consideration the context. Yes.
All right, we do have our neighboring countries, especially Rwanda, and we have the president who's very passionate about National Cleaning Days.
Yes.
Which is very, it's actually a pivotal, exercise with regards to ensuring that their environment now plays along with regards to eradicating this particular, we call epidemic. Now, are we going to see Uganda take this up as well? A National Cleaning Day where every community comes together and takes, responsibility over their dirt and cleans that up, and then we see it, become a habit slowly by slowly. Because, the environment is a key thing. The director did play some cutaways, of course, as we were having this conversation. In slums, especially now that we're in the rainy season, we have, drainages, pools of water. This, of course, being, breeding grounds for this malaria, this mosquitoes. So what... Are we going to see this coming up anytime soon? Is the Ministry of Health maybe brainstorming on the same?
Yes. Now, your point actually lies within the parliamentary forum that is fighting against malaria, where the local leadership actually inspires the community to take that type of action. And rather than it coming from the center, telling people that have community cleaning days, we want that type of solution to come from the community itself. Ownership is very, very important in all these interventions. When you identify something like it's yours, the way I can look at this tire and say it's mine, it has to be clean. That is how we want the community to start looking at their environment down there. And we believe that that intervention of community cleaning days can actually come from the grassroots. And that is what we want to achieve. And if it doesn't come, what's next? We are already seeing. Can we have the leaders influence the same? Yes, we're already seeing collective action in some places, and we are actually highlighting best practices. There are some municipalities that are very clean, very, very clean, and it is largely driven by the local leadership. And that is what we are looking at. We are saying that let's promote best practices and let's have some form of competition between the districts, and that will actually help. But it has to come from the community itself. All right. Yeah. Okay. Thank you so much for coming in studios. We've learned quite a bit. Keep your views coming. The hashtag is Morning at 10 TV. Thank you so much, Dr. Henry Katamba, of course, from the Ministry of Health. What can be done? What more can you and I do, yes, to fight this particular endemic, of course, with the sole mission of ensuring that we bring down the numbers to nothing but zero, all right? That's the conversation right here on Take Note. Don't go too far. Morning at 10 TV still continues. I'll be back with the business updates.
To enhance your weekends, your long-awaited drama series, Power of Legacy, premieres on Sunday,